To learn more about earning college credits with study hall courses, go to gostudyhall.com or click the link in the description. Do you ever feel like no matter what you do, your apartment is never really clean? Like maybe you spend an afternoon tackling all the laundry and washing all the dishes and vacuuming all over. You feel so accomplished. But then, because you spent all afternoon cleaning, you're hungry and thirsty, and you want to change out of your grubby clothes. So your apartment is only completely clean for like 5 minutes before you put more dirty clothes in your laundry basket and add another dirty dish to the sink and drop some crumbs on your freshly vacuumed rug. It's an endless cycle. Eventually, you can kind of get into a rhythm with these routine tasks. You know your habits, and you know when you tend to let the dishes pile up, so you can figure out how to stay on top of things so that you always have at least one clean bowl to use. Staying on top of things also makes it less likely that you'll run into bigger issues like, say, an infestation of ants. But sometimes, something completely unexpected might happen. Like your power goes out and all the food in your freezer goes bad. No matter how good you are at cleaning, you can't prepare for something like that. So, what's my point? Well, besides teaching you some valuable life lessons about the importance of washing your dishes, stick with me here, your body is kind of like an apartment. Hi, I'm Deja Fitzgerald, and this is Study Hall, Intro to Psychology. In our episode about health psychology, we talked about the biopsychosocial model of health. Health psychologists use this model to provide support to the whole person, including, you guessed it, biological, psychological, and social factors that affect a person's well-being. But that doesn't just apply to immediate health concerns, like the headaches we talked about in the other episode. It also applies to long-term, big-picture elements of our health. Because the thing is, we live in our bodies for our whole lives. See what I'm doing here? And if we want to stay healthy, we don't just go to the doctor once and call it good. We need to take care of ourselves all the time. And that includes everyday things like eating well, occasional things like routine doctor's appointments, and things like getting treatment for an unexpected illness or injury. As humans, we're not always very good at taking care of our bodies. But when we understand more about the big picture, we can often make decisions to help maintain our health or prevent negative outcomes. One area that's particularly interesting to health psychologists is long-term or chronic diseases, like cardiovascular diseases and cancers. A person might have options for intensive treatments to aim for a cure, but there are also things they can do to help with their overall well-being. Generally speaking, anything that can increase the chances of someone developing a specific disease is a risk factor. And many health psychologists are interested in understanding what risk factors are within our control when it comes to chronic illnesses. One big risk factor is stress, mostly because it's everywhere. You've got bills to pay and emails to answer and groceries to buy and more dishes to wash. Stress is physical or mental tension created by anything you might perceive as a challenge. Everyone feels some stress, and a certain amount can help us stay motivated to get better at budgeting so we can afford more music festival tickets. But long-term, constant stress, also known as chronic stress, may actually impact our health in serious ways. In the 1960s, 3 mental health researchers came up with the diathesis-stress model, which generally says that disease is caused by a combination of your personal biology and stressors. So your high blood pressure is definitely your mom's fault. She passed on the genes and she won't stop nagging you about getting health insurance. Biological factors, like your genetics or the amount of hormones your body makes, are risk factors for disease that are beyond your control. You can't swap out your genes any more than you can stop aging. So maybe it's time to stop watching all these TikTok beauty videos. On the other hand, stressors are considered psychosocial risk factors caused by your environment. You might be able to learn healthy coping strategies for some stressors, like going to therapy after a breakup. But other stressors are a bit more difficult to handle, like being displaced by a natural disaster. By studying how the nervous system interacts with the immune system, researchers can investigate how these two types of risk factors affect the body. For example, stressful experiences can actually reduce how well your immune system functions, making you more vulnerable to infectious or chronic diseases. There are a lot of chemical and biological systems at play though, so researchers are still trying to isolate just how strong this link is. Not to mention, just like people experience stress differently, our biological reactions to stress aren't universal. In other words, we can't flat out say that heartbreak leads to heart disease, though it's romantic in movies to say he died of a broken heart. It's more nuanced than that. The psychological stress from a breakup for some people can lead to physical symptoms or even sickness. Just like stress isn't one size fits all, risk factors can vary from person to person and disease to disease. Health psychologists can use risk factors to understand illnesses, look for patterns, and develop treatment plans that work for individual people and their unique circumstances. Let's look at cardiovascular diseases, which are prevalent in many places around the world. Some risk factors for these diseases are completely out of your control, like your age, family history, or certain systemic issues that may lead to more stress. But health psychologists might draw on research like the biopsychosocial model or the diathesis-stress model to look for risk factors that their patients can change through a combination of psychological, behavioral, and pharmacological interventions. And according to the box of Cheerios in my cabinet, just eat those and you're Gucci. Some patients might have more psychosocial risk factors for cardiovascular disease, like intense daily stressors or loneliness. For example, one patient might spend very little time with other people because they live alone, they work from home, and they have social anxiety. So a health psychologist might help them find a therapist to help work through their anxiety, or find some local community groups to join, because yes, building a support system of friends can reduce these risk factors. Psychosocial interventions can overlap with treatment plans that target behaviors, which are focused on the day-to-day choices we make. Patients with behavioral risk factors for cardiovascular disease may smoke cigarettes regularly or not move very much in their daily lives, maybe because they work at a desk all day. Oh, great. I've been here for hours. Thanks, guys. For a patient who's having trouble breaking a smoking habit, a health psychologist might help them find medications that counteract their body's chemical dependency on nicotine, or a support group with other patients who are also trying to stop smoking. In fact, health psychologists often work alongside medical doctors who flag biomedical risk factors in patients and can prescribe medication as a treatment. In the case of cardiovascular disease, these risk factors might include high blood pressure or high cholesterol levels. A treatment plan for someone with high cholesterol could include a biomedical intervention, like cholesterol medication, along with behavioral treatments, like an adjusted diet or advice to take walks during the workday. As you can probably gather from these examples, or well, living your life, risk factors are messy and often intertwined. Risk factors can combine to increase the chance of illness, but the flip side is true too. Many of these treatments or interventions end up reducing multiple risk factors. For example, when someone gets more exercise and lowers their blood pressure through medication, they may reduce their stress levels and sleep better, which may help them tackle behavioral challenges like quitting smoking. Changing behavior is actually the key to a lot of risk factor interventions, and whether someone only is at risk for developing an illness or they're living with a chronic disease, learning new tools and behaviors can often help with their overall wellness. As early as 1977, the clinical health psychology researchers Prochaska and DiClemente were studying smoking cessation and what it meant for our understanding of addiction. They created what's known as the stages of change model, a framework for steps and obstacles of behavioral change. Since then, this model has been applied to lots of healthcare provider-recommended behavioral changes because change isn't easy. Let's say that Eddie grew up in a family that mostly ate animal-based foods like beef and dairy. A fresh fruit or vegetable was a rare sight. Eddie's never thought about eating differently, even though his most recent blood test shows a calcium deficiency. Eddie is in the first stage, pre-contemplation. He feels fine and has no reason to think that his diet could be connected to a risk for some illnesses. Contemplation happens when Eddie begins to give his blood test more thought. He thought he was getting plenty of calcium from drinking milk, so his doctor explains that the calcium in certain vegetables is more readily absorbed and used by human bodies than the calcium in dairy products. Eddie's not ready to change his diet at this stage because he loves steak, but he's thinking about the information rather than dismissing it. Preparation is the third stage, where Eddie starts to think about making some diet changes. He looks up some veggie stir-fry recipes and reaches out to a nutritionist to learn which vegetables are good sources of calcium. Action is when he decides to take the leap and make a change. This fourth stage in the process doesn't happen overnight. It can take time to unlearn and relearn lifestyle choices. But after a few months of experimentation in the kitchen, Eddie realizes that he actually kind of loves kale. And when he goes back to that original healthcare provider for a checkup, his blood tests are coming back more balanced. The final stage, maintenance, is about making sure these behavior changes stick around long enough to become a normal part of life. So now when Eddie celebrates holidays with his family, he adds his favorite kale salad to the end of the buffet. Change isn't easy, especially when there are more biological or chemical factors affecting your choices, like how alcohol, nicotine, or caffeine can be habit-forming substances. And the Stages of Change model can help us remember that behavioral change is hard for a lot of people, and it can take time. Everyone's health journey is personal and complicated, and there's lots that isn't in our control, and that we can't prepare for, just like when the power goes out in your apartment and everything in the freezer spoils. And even when we can prepare, there may be challenges, like maybe our insurance doesn't cover certain treatments, or kale salad isn't really in the budget right now. But awareness of all the different factors that contribute to our overall health can help us see the places where we can make changes and do small things to care for ourselves. Because in the same way that regular maintenance makes it less likely that we have major issues in our homes, taking care of our bodies makes it less likely we'll have a major medical issue. Even though it would be nice if we could just go to the doctor once and call it good, taking good care of your body means you're taking lots of time to really understand yourself. You'll know better than anyone when something doesn't feel right, which means you'll be prepared to advocate for yourself if something unexpected does happen. And that knowledge can go a long way for making sure you get the care and treatment you deserve to continue keeping yourself healthy and well cared for. If you're enjoying Study Hall, Intro to Psychology, and are interested in taking an online course and earning college credit, go to gostudyhall.com or click on this button to learn more. Thanks for watching. See you next time.